Doctors and community leaders say next to no monitoring of air pollution is putting Central Queensland residents at risk. Although many towns in the region are surrounded by coal mines, very little is known about the impact it's having on people's health.
The Bowen Basin is Queensland's coal mining heartland. It's drawn thousands of families to live and work here, but that decision could be affecting their health.
As a doctor, you see people with asthma, you see people with a lot of allergic problems such as allergic rhinitis, runny nose and coughing and sneezing. But you also see people with heart disease, you see people with chronic lung problems. And it's not just bad luck.
He says it's likely they're breathing in potentially deadly particle pollution.
Air pollution kills more than 3,000 Australians prematurely each year. Particle pollution is responsible for most of those deaths.
Coal mines are one of the biggest sources of particle matter in the nation, but in the Bowen Basin, little is being done to monitor health impacts. The state government only operates one air quality monitoring station in Moranbah, and community leaders say it's not good enough.
It's important for everyone to make sure that these things are monitored, that people have an understanding of what the levels are, so that they can make decisions about their own health, their family's health.
In parts of the Hunter Valley, for instance, community members can access data anytime they like and in fact can receive an SMS to their mobile phone whenever pollution levels are likely to exceed the national standards.
But Queensland is behind. The State Environment Department says its current monitoring shows air quality in Central Queensland is generally within acceptable standards, and it has no plans to roll out a further monitoring network. It says most mines are required to report when air pollution exceeds recommended levels, but that doesn't reveal the impact on towns.
If we put our head in the sand and we ignore it, then we won't find problems until people are actually suffering significant illness.
And by then, it will be too late. Alyse, ABC News, Central Queensland.